Hi guys, Tracy and Doss. Welcome to my channel. Today we're going to do a recap of a documentary I've watched relatively often for a reason. It's called Plastic Disasters. I'm from Orange County. There's a lot of plastic surgery out here. When I'm ever feeling a little certain type of way about myself, I watch this video. So before we get into it, I just wanted to say this video is for entertainment purposes only, so please like, share, and subscribe and help me build my channel. So we're just gonna start off this video with 3 stories and 3 disasters. Lucille, an absolutely stunning woman, is the first story in this documentary, and she was a real looker when she was younger. Just beautiful. And of course she didn't have any problems with the way she looked or the way her body looked, but when she got to a certain age, she started chasing that I want to look like I was when I was 20, and that's when her plastic surgery nightmare began. She talks about the things that she needs done, and first she talks about her 11s and the nasolabial folds around her mouth, and then the filler in her lips. So it starts there, as many plastic surgery patients begin subtly, and it almost becomes an obsession. I mean, that's the pattern that I see in most plastic surgery nightmare cases. It's just never enough, and just one more surgery and all be perfect. And you know, you're never going to recreate the youth of your 20s. So what ends up happening is multiple surgeries, complications, and then the disasters happen as well. So the collagen was an instant improvement, and she liked what she saw, and it gave her some sort of high. And this is when she continued on to the next surgery and the next surgery and the next surgery. The next story we'll talk about is Mona. And Mona is an athlete. She loves to go bowling with her husband. She goes to the gym every day, and she walks every night, and she is in great health. But she cannot seem to get rid of that little roll around her waist, and it's bothering her. And she's noticing a commercial on TV all night long. Every day she's seeing the same commercial of these super young, vivacious women with lots of energy, with the perfect bodies. And she wants this. This is what this commercial is promising, and she decides to go get a consultation, and she brings her husband in, and they tell her husband and herself that it's good for diabetes, which is so crazy to me, to think any kind of major surgery would be good for diabetes because of the wound healing problems in diabetes. But nonetheless, he tells her to get this extra weight off of her will be good for her. So her husband is now on board, and this is when Mona's plastic disaster begins. She was instantly nauseous after surgery, and she was in immense pain, and they gave it a little time, and when she called the doctor, he said just give it a couple weeks. After a couple weeks, she was still in incredible pain, so they went back to the surgery center, and she could barely breathe. They sent her to her primary care doctor for a chest exam, and he took blood work and x-rays, and it was discovered that her bodily fluids were leaking through her intestinal wall, and this was a problem. So she was immediately admitted to surgery, and then 2 weeks after the infection, it had caused so much damage in her body, and it was irreparable damage. And she just continued to pray that this disaster and this nightmare would be over soon. The next journey is about Tony, and this particular case is strictly vanity. And I feel like they all are, actually, initially. And he felt like his nose made him look older. So he, when this story takes place, he had already had multiple surgeries 3 years prior to meeting Dr. Nassif, who was going to try to help him with his plastic disaster. He had had an unsuccessful rhinoplasty, and it was followed up by a revision surgery. His third surgery was a silicone implant, and he felt it was too big, and he could feel it where it had detached, and he was concerned it would break through the skin. And then his fourth surgery, he started to have breathing problems. And this is when he had approached Dr. Nassif for help. And Dr. Nassif studied the pictures. He is really a genius in this field. And he is really the first place you should go, not the last place, because you'll have much more success having him do the initial surgery, even if it's more expensive. That's why he is expensive, is because he's so good at what he does. The damage to the dermis on the nose, it has become really thin. And, patients have a tendency to blame the doctors, but everyone heals differently and everybody's body's different. It depends on alcohol consumption, smoking, exercise. These are all a factor in how well you're going to heal and how successful your surgery is going to be. And Dr. Nassif talks about this a lot when he meets with his patients. He's very open and honest about the procedures and the possibility of problems before he gets started and takes on the patient. So back to Lucille. Because she was so happy with the collagen injections, she just wanted more, like most patients do. And that's when she decided to have her first facelift. And she describes herself as cautious, but I don't describe her that way, because after her first facelift, she had a rhinoplasty, like within 8 weeks. And I was always under the impression you should any kind of second plastic surgery. It takes that long for your body to heal. And she didn't wait. And I feel like this was the start of her problems, because her face just blew up. And when it collapsed or went back down, she had all this loose skin. And that made her really unhappy. And that led her to her second facelift, which, of course, she wasn't happy with either. And she talked to the doctors and said that this wasn't acceptable. And they said, look, you need to go see a therapist. They sent her to a therapist, and she agreed to do that. And she found out that the therapist was a BDD specialist, which stands for body dysmorphic disorder. And I really feel like a lot of these patients that go back for multiple surgeries already have this. And a lot of plastic surgeons I think they give an assessment to see if you have this, but I mean, who knows until you start getting multiple surgeries if this is an issue. I don't know how you would really assess it beforehand, but it gave them concern the way she was acting. And she writes a note to her doctors that says, upon my death, I will send you my severed head for dissection. And that's just a little bit too much, right? I mean, the doctors are a little bit concerned about her mental state. The hospital took out a restraining order against her. Lucille says she looks 20 years older since her facelift a year prior. And she now has this hanging flesh, and she is just beside herself about it. She wants to go back to before she ever had any plastic surgery. But instead of doing that, she has a second facelift, and this led to more problems. I mean, now it's affected her breathing, and again, the swelling, and who knows what causes that? Just the trauma from having so much plastic surgery, or is she having some kind of allergic reaction to the anesthesia, or who knows? But she starts to have problems swallowing, and the doctor said, after examining her and doing x-rays, they say, you're not having any problem swallowing. This is all in your head. There's nothing wrong with you. And she doesn't agree. She is in pain whenever she swallows, and this leads to her obsessive and constant messaging to these doctors and hospitals about what's going on, and she keeps having more people look at her, and it's always the same conclusion. There's nothing wrong with you. You have developed a psychological problem. So Steve is Lucille's former employer, and he talks about the Lucille that he knew before all the surgeries, and she was always well presented. She always had her hair done and her makeup done and dressed perfectly. And the Lucille that you see in the documentary is not this Lucille. She doesn't look like she ever brushes her hair. She just is in pain, and she just can't function the way she used to function. And I think there's quite a bit of depression included in this situation. So our sweet Mona is now in a wheelchair, and she has bed sores that just won't heal. She has one particular spot in between her toes that turned into a bigger spot, and her toe turned black, and the veins started to collapse. And they had to get in there and perform surgery because gangrene had set in. When Mona woke up from the surgery, she noticed she had no leg. Now, this is everybody's nightmare. And what started off below the knee became worse. They had to go above the knee, and they had to go higher, and it just wouldn't heal. So not only did she have no leg, but now she has a colostomy bag, and this nightmare is just never ending. She goes to bed praying, she wakes up praying, and then just one complication after the other. Dr. F. True Lanson talks about his time at the clinic and how they push these surgeons to do up to 8 surgeries a day, which is just way too much for a surgeon. I mean, that's completely exhausting. And to be able to perform that much surgery in one day, you're going to get lax and problems are going to occur. And the infiltration that you do with the long tube is very dangerous. It needs to be done very carefully and very precise, and you could easily pierce the abdominal lining and enter the gut, which is what happened to Mona. You can also pierce the chest wall, which can cause breathing problems. And these things cause the most problems in these surgeries. Now, Dr. Nassif is very clear that most of these surgeries are elective, and these doctors are not God, and they can only do the best that they can do, which in Dr. Nassif's case, he's one of the best plastic surgeons around, and he is very particular about people's expectations, about people's well-being mentally, and he knows that patients can have very unrealistic expectations. So he tries to talk about that with his patients before he starts the surgeries. And he reviews Tony's picture and sees a lot of problems there. He sees that the tip is starting to collapse and there's no support on his nose and he can't breathe properly. By the third surgery, in the pictures, Dr. Nassif can see the thinning of the skin and possible necrosis. This could be a real problem for Dr. Nassif and for Tony. Well, Mona's nightmare continues, and the heel on her other leg starts to cause problems for her. It turns black and it craters. And it's inevitable what's going to happen next. She's going to have another amputation. And the casual warning of these procedures is a real problem in the industry. I mean, nose job, butt lift, tummy tuck. They give the illusion of these procedures being not very serious, when in fact they're very serious and they're very dangerous. And when you're operating around the eyes, it could cause blindness. When you're operating around the nose, you can have problems breathing. And then when you're operating on the face with facelifts, you can cause sensitivity and motor issues, which can be rather deforming. So Mona's story, I mean, she's now in a wheelchair. She's got 2 amputations of her legs. I mean, their retirement was supposed to be traveling, bowling, and all sorts of fun, active things. And now she has a hard time getting around. And, well, she just doesn't feel good. It's just not the retirement that either of them had expected. And if she could go back, she would. They talked to their lawyer in the documentary, and Stuart Rasdin, he claims all the nurses and doctors at the clinic on the day of her surgery say that they did not perform surgery on her. They were not a part of this. And with the confidentiality laws and all the papers you sign, the hospitals and the clinics are just not going to release that information to anybody. They're going to protect their surgeons, and you really have no recourse. But he does say the real problem and the person that should be sued is the doctor that perforated her stomach lining. And if they could figure out who that is, then they have a case. But otherwise, it's dead in the water. And Mona talks about the show The Swans, one of the shows that she enjoyed watching, and gave her this kind of false sense of what this surgery was really like. These contestants were waited on hand and foot for 3 months after their transformations, and one of them even died. But of course they don't air that. They don't tell the world about the problems. They just show the positive outcomes. And we realize, you know, reality TV is not reality. And this is probably one of the reasons why she decided that plastic surgery was for her, because she believed in what they were selling her on TV. Now, Dr. Nassif is not your ordinary doctor, and he is not only really honest, like I said, with his patients, but he almost talks them out of surgery. And you can see this on the show Botched. He lets them know, look, it could be worse than now. You know, you're really taking a chance here, especially when you've had multiple surgeries. And a lot of these clinics are offering like 2-for-1s. A lot of patients go down to Mexico. A lot of people have not just surgeries, but like silicone implants and stuff in hotels and just really unsterile environments. And this is a cause for a lot of problems as well. And people need to be a lot more careful. They need to not be skimping on the price of plastic surgery. If you're going to do this, you do this right. You go to doctors like Dr. Nassif in the beginning, not to go fix something, but in your initial surgery. And you really should realize that this surgery is not going to fix your problems. It's not going to make you look younger. And all three of these people realize that they were the initial creator of their problems. And all three people wish that they had never gone down that road, that if they could just go back to their former selves, their former bodies, they would be so much happier, but they can't. This is a permanent decision and they have to live with it. The damage is irreversible. And you can't change bad decisions. We can't return our faces and our bodies to our younger years. It's impossible. The real challenge of aging is accepting that our bodies and our faces change. And we should put our energy into things like developing our relationships with our family and friends. And we should focus on our hobbies and our future, not our pasts. Well, thanks, guys. I hope you like this documentary. It is hard to watch at times, but it's very informative. And I really feel like we all need to take a little glimpse at what could happen and just be happy with where we are in life and who we are, and try to just grow old gracefully. It's not for the faint of heart, that's for sure. Okay, take care, you guys. I'll talk to you soon.